All right. So we're looking at some other connective tissue disorders. So this is what is known as hereditary motor and sensory neuropathy. Hereditary motor and what? Sensory neuropathy. So what does it mean? So it's not really like one disease condition. It's a group. Okay. So it's a group of inherited disorders. They affect the peripheral nerves. So this is nerves that are outside the spinal cord and the brain. These nerves are the ones that are taking instructions to know your hand, your foot, and all of that. So this condition interfere with both motor function, that's how they are able to move, and sensory function, that's how they are able to perceive something. All right. So it leads to what? Progressive muscle weakness and sensory loss. Especially the limbs are affected. That's why you have your foot here. There's one popular one which is known as a Charcot tooth disease. Okay. So is inherited and can follow autosomal dominant, autosomal recessive, or X-linked patterns. So there's mutations on what? Chromosome 17 and 1. So common types, you have the Charcot-Marie, which is the type 1. We have the axonal type with degeneration of nerve fibers, which is type 2. Then 3 to 7 include things like the Dejerin-Sotar's disease, Refsum disease, and all of that. Okay. So symptoms is what? Muscle weakness and atrophy, especially in the legs and hands. High arched feet, that's pes cavus. Hammer toes, foot drop, loss of sensation. The person has balancing issues, right? Is tired. In severe cases, scoliosis can come in, vision issues, or hearing impairment. So diagnosis is physical examination. You just want to check for muscle atrophy. You want to look at the part of the body that is affected. Like for this now, I can see the high arch foot and all of that. Then electromyography, you want to look at the muscle and the nerve. How is conduction going in between these two guys? Then genetic testing, just for confirmation. So management, there's no cure, but just manage the symptoms. So physical therapy and stretching, braces or orthopedic surgery for foot deformities, pain management and occupational therapy, then genetic counseling for families.